Good morning. My name is Dr. Elizabeth Igaga, and I serve as Smile Train Senior Director for Program Safety. My project was to develop a well-being toolkit for women in anesthesia and surgery, and I'm going to present part one, which was identifying the current state of well-being among health workers in the healthcare workspace. This project was born out of a personal experience in the workspace that left me feeling burnt out, inefficient, and unable to achieve my full potential at work. Well-being usually takes the back burner at the expense of patient care because of problems with perception. People prefer to suffer silently because culture and societal expectations do not support taking care of one's well-being, and there's minimal advocacy with lack of representation at the decision-making table. So we decided to measure the current state of well-being among women in anesthesia and surgery. We approached the professional societies for their databases and sought the necessary permissions and sent out an electronic survey by email and WhatsApp and followed up by phone call and weekly reminders for 3 weeks. We had an enthusiastic response from some of the stakeholders, and there was concern raised by the men on why we were targeting women only, and yet men also contribute largely to well-being in the workspace. Some of the challenges we faced included survey fatigue and incomplete surveys, but also delays due to the foreign nature of the concept that was being presented and the fact that well-being is considered a luxurious problem to have. Almost 60% of the target group responded, and majority of them were from anesthesia. 66% of our respondents were between the age of 30 and 39, were in their early careers, and had children between the ages of 0 to 5 years of age. All our respondents were knowledgeable on what well-being was, and half of them said they didn't know whether there was a workplace policy on well-being, while the other half said there was none. Half of our respondents do not exercise regularly as recommended by the WHO. 72% of them are dissatisfied with their sleep despite getting an average of 6 to 8 hours of sleep per day. 44% of them mentioned that they had experienced hardships due to their periods, and 68% said there was no workplace flexibility and were uncomfortable discussing menstrual health with their line managers. 50% said they were not paid fairly and are financially insecure, and 43% of them were not confident in their retirement planning. 54% of our respondents work 60 plus hours a week, an average of 10 to 12 hours a day, and in the facilities in which they work, 97% had no provision for childcare. 60% of them also had no flexibility for young mothers. Only 31% of them found their workplaces inclusive and mentioned that there were informal reintegration policies, but these were particularly targeted to nurses and support staff. Only 34% of them were satisfied with their job, and almost 50% of them were neutral on whether their professional growth and career progression was going in the direction that they wanted it to. In the future, we hope to use these results to collaborate to develop a toolkit on well-being alongside the professional societies and implement the same. I hope to continue this work as a PhD project on health worker well-being and provision of contextualized solutions, and also hope to develop a policy brief that will be endorsed by the Association of Anesthesiologists of Uganda and presented to the Ministry of Health. My WomenLift Health growth journey has been phenomenal. I have learned to accept who I am and what leadership is. And I have also learned to lead in unconventional spaces where it counts. Apart from my personal growth, I have been approached to mentor and coach different people in their leadership journeys and generally in their career journeys. But I've also been able to expand my reach where leadership is concerned. I enrolled for a storytelling fellowship that has strengthened the way I tell my story, and have also learned to embrace different leadership styles and meet people where they are. Thank you, WomenLift Health, for the opportunity, and I hope to continue this work with you. Thank you.